Therapy Dog kept alerting to a spot on the sick child's chest, breaking all protocols and infuriating the hospital's chief doctor. "Get that animal out," he demanded, but when they finally scanned where the dog had been focusing, what they found hidden beneath the standard diagnosis left the entire medical staff speechless and changed hospital policy forever. Now, before we get into today's story, drop a comment below telling us where in the world you're watching from. And if you love extraordinary police dog stories like this one, make sure to hit that subscribe button. You won't want to miss what's coming next. The crisp autumn air carried the scent of antiseptic through the sliding doors of Children's Memorial Hospital as Candace Wheeler guided Rex, her 4-year-old golden retriever, across the polished lobby floor. The therapy dog's nails clicked rhythmically against the tile, his blue therapy vest immaculate as morning sunlight streamed through the east-facing windows. Rex held his head high, carrying himself with the quiet dignity that had made him one of the hospital's most beloved visitors. Unlike some therapy dogs who bounded excitedly from patient to patient, Rex possessed a remarkable ability to match his energy to each child's needs, gentle and subdued with the critically ill, playful with those on the mend. "Good morning, Ms. Wheeler," called the receptionist, her smile brightening at Rex's wagging tail. "The 6th floor is expecting you both." Candace nodded, adjusting her visitor badge. "Thanks, Marge. Has anyone canceled today?" "Not canceled, but there's a new patient added to your rounds. Emily Winters, room 612. Pneumonia case. Been here about a week. Poor thing isn't responding to antibiotics as quickly as expected." The elevator doors opened to reveal Dr. Elijah Pembroke, the hospital's newly appointed chief of pediatric medicine. His expression hardened instantly at the sight of Rex. "Ms. Wheeler," he acknowledged stiffly, stepping out, while maintaining careful distance from the dog, "I see the animal visitation program continues despite my recommendations to the board." Candace maintained her professional smile. "Good morning, Dr. Pembroke. The therapy program has shown exceptional results in patient recovery times and emotional well-being. Animals carry bacteria regardless of how well you bathe them," Dr. Pembroke replied, his voice clipped. "These children have compromised immune systems. Every external factor introduces unnecessary risk. Rex is cleaned using medical-grade products before every visit," Candace countered calmly. "The protocols were developed with infectious disease specialists." Dr. Pembroke's mouth tightened into a thin line. "Just keep that animal away from my critical cases. Particularly room 612. Emily Winters doesn't need fur in her lungs on top of pneumonia." Before Candace could respond, he strode away, lab coat flapping behind him like a battle flag. "Well, Rex," Candace whispered as they stepped into the elevator, "looks like we've just been specifically asked to avoid the very patient who's been added to our rounds." Rex looked up at her with attentive eyes that seemed to understand the complexity of the situation far more than any animal should. Candace hadn't planned on becoming a therapy dog handler. 6 years ago, she'd been climbing the corporate ladder at a marketing firm when her niece Lily was hospitalized after a car accident. For weeks, the 8-year-old had remained withdrawn, barely speaking to doctors or family. Then one Tuesday afternoon, a chocolate Labrador named Marley had padded into Lily's room, resting his gentle head on her bed. The transformation had been immediate and astonishing. Lily's first smile in weeks, followed by whispered secrets into the dog's attentive ears. "That's the first time she's communicated in days," the neurologist had remarked with undisguised amazement. It was there, watching Lily's remarkable response to the therapy animal, that Candace first understood the profound impact these animals could have. She resigned from her 6-figure job the following week, adopted Rex as a 12-week-old puppy from a respected breeder, and invested everything in his training. They'd spent 18 months in specialized therapy dog programs, Rex displaying an intuitive understanding that trainers described as 1 in 1,000. His certification evaluator had written simply, "Extraordinary empathy and focus, perfect temperament for pediatric work." Most of the medical staff had come to appreciate the program. Nurses reported that patients required less pain medication on therapy days. Physical therapists noted increased participation. Dr. Pembroke remained the notable exception, citing studies on zoonotic disease transmission at every opportunity, his prestigious background in infectious disease giving weight to his objections. Candace had researched him after their first confrontation, discovering his published papers on hospital-acquired infections and a profile in a medical journal that described him as brilliantly methodical with a relentless commitment to evidence-based protocols. What the article hadn't mentioned was his apparent inability to see beyond statistics to the human element of healing, something the nurses frequently discussed in hushed tones during coffee breaks. Nurse Patel greeted them as the elevator doors opened. "Thank goodness you're here. We've got several patients who could really use Rex's magic today." "Dr. Pembroke just specifically asked me to avoid room 612, Candace replied hesitantly. Nurse Patel frowned. "That's odd. Emily's parents actually requested the therapy program yesterday. They're desperate for anything that might lift her spirits." "Is Dr. Pembroke her primary physician?" "No, that's Dr. Levine. Pembroke consults on all respiratory cases." Nurse Patel lowered her voice. "Between us, he's brilliant but has the bedside manner of a textbook. If the parents requested it and the attending physician hasn't objected, I'd proceed with the visit," Nurse Patel confirmed. "Dr. Pembroke isn't in this wing today anyway." They began their regular rounds before approaching room 612. The space had the hushed atmosphere of prolonged illness. Blinds partially drawn, monitors humming quietly. Emily Winters looked impossibly small in her hospital bed, oxygen tubes secured beneath her nose. Her mother dozed uncomfortably in the recliner beside the bed, hand still reaching toward her daughter, even in sleep. Candace knocked softly. "Hello, I'm Candace Wheeler with the Therapy Dog program." Sarah Winters startled awake, momentarily disoriented before focusing on Rex. "You came," she said, her voice rough from sleep. "They said you might." "Is this a good time for Emily to meet Rex?" "Please," Sarah insisted. "Emily's been asking about the therapy dogs since she heard about them." The little girl's eyes fluttered open, fever bright in her pale face. When her gaze landed on Rex, a whisper of a smile touched her lips. "Is that for me?" Emily's voice was barely audible, scratchy from coughing. "This is Rex," Candace introduced, guiding the retriever closer. "He visits children here to help them feel better." Emily's hand trembled slightly as she extended it toward Rex. The golden retriever lowered his head to make himself less imposing. "He's so soft," Emily whispered, as her fingers connected with his fur. "Can he come up closer?" Candace assessed the situation before spreading a clean sheet across the foot of Emily's bed. "Rex, visit." Rex placed his front paws delicately on the protected portion of the bed, keeping his body primarily on the floor, but bringing his head within easy reach. Emily's smile widened fractionally as she stroked his ears. For 20 minutes, Emily engaged with Rex more than she had with anything in days. She giggled weakly when he balanced a toy on his nose, and her eyes widened with delight when he gently high-fived her extended hand. "5 more minutes, Emily," Sarah eventually said, noting her daughter's drooping eyelids. "You need to rest." Candace prepared to give the command that would bring Rex back to heel position. "Rex, thank—" She stopped mid-command, puzzled. Rex, who had never once failed to respond instantly to instruction, remained firmly in place. His posture had changed subtly, muscles tense, attention completely focused on Emily, particularly the left side of her chest. "Rex," Candace repeated more firmly. "Thank you." The retriever acknowledged the command with a flick of his ear, but didn't move. Instead, he shifted closer to Emily, his nose working intently near her left side. "Is something wrong?" Sarah asked, anxiety threading through her voice. "No, he's just—" Candace hesitated, uncertain how to explain behavior she'd never seen before. "He seems very attentive to Emily." Emily's eyes had closed, exhaustion claiming her. Her breathing seemed more labored now, each inhalation a visible effort. For the first time in their partnership, Rex broke protocol completely. Instead of returning to Candace's side, he gently laid his head directly on the bed beside Emily's left side, his body rigid with alerting behavior. the posture he'd been taught to assume when finding something significant. "I'm sorry," Candace apologized, genuinely confused. "He's never done this before." A throat cleared sharply from the doorway. "What is that animal doing on my patient's bed?" Dr. Elijah Pembroke stood in the entrance, his expression thunderous as he took in the scene. "I specifically instructed you to avoid this room," he stated coldly. "This patient has a severe respiratory infection. Get that animal away from her immediately." Candace moved quickly to Rex's side. "I'm sorry, doctor. Rex has never refused commands before. The parents had requested the therapy visit, and you thought your dog's comfort services trumped medical expertise?" His voice remained clinical, but carried unmistakable disdain. Sarah stepped forward protectively. "I approved the visit, Dr. Pembroke. Emily has been miserable for days. This is the first time she's smiled since last weekend." "Emotional comfort doesn't clear bacterial infections," Mrs. Winters, Dr. Pembroke countered, checking Emily's monitors. "Her oxygen saturation has dropped 2 points since this morning." Candace finally coaxed Rex away, though the dog's resistance remained unusual. In the hallway, she knelt beside him, searching his behavior for clues. That evening, Candace called her mentor, Dr. Vihan Mehta, a veterinarian who specialized in animal behavior. "It's extremely unusual for Rex to break command," she explained. "He seemed fixated on the left side of her chest, almost like he was alerting, but we've never trained him for medical detection." "Dogs can recognize patterns and scents we cannot perceive," Dr. Mehta replied thoughtfully. "There are documented cases of untrained dogs alerting to cancers, seizures, even dangerous blood sugar levels. Their olfactory capabilities are extraordinary." "But what could he be sensing in a pneumonia case?" "Difficult to say. Could be nothing. Could be something the medical tests haven't caught yet." 2 days later, Candace returned to the hospital. Nurse Patel intercepted her. "Emily Winters is still on your approved list," she said quietly. "Her mother specifically requested you return. But Dr. Pembroke has been quite vocal about not wanting Rex in that room." "How is Emily doing?" "Not well. The antibiotics aren't producing the improvement we'd expect. They're considering transferring her to the university hospital." Inside room 612, Emily appeared markedly worse. Dark circles shadowed her eyes, and her breathing seemed more labored, despite increased oxygen support. Still, she brightened visibly when Rex entered. The visit proceeded normally, until they prepared to leave. Once again, Rex planted himself firmly beside Emily's bed, refusing to depart. This time, his focus on her left side was even more pronounced, his nose working actively as if tracking a scent. "He's doing it again," Sarah observed, "focusing on her left side like that." Candace nodded slowly. "Has she been complaining of any specific pain there?" "She mentioned some discomfort yesterday, but Dr. Pembroke said it's normal with pneumonia, fluid in the lungs causing pressure." "Mrs. Winters, this may sound strange, but there are documented cases of dogs detecting medical conditions that haven't been diagnosed yet. Their sense of smell can identify subtle chemical changes in the body." "You think Rex is sensing something?" "I can't make medical claims," Candace clarified quickly, "but his behavior is extremely unusual. It might be worth mentioning to Dr. Levine." The pattern continued for 3 more visits. Each time, Rex became increasingly insistent about remaining with Emily, focusing exclusively on her left side. Candace documented each incident carefully, noting Emily's worsening condition despite changing antibiotic regimens. During the 4th visit, she encountered Dr. Levine in the hallway. The gray-haired physician looked exhausted, worry lines deepening his already weathered face. "Dr. Levine, could I speak with you privately about Emily Winters?" Candace explained Rex's unusual behavior, his specific focus on Emily's left lung area, and the research she'd compiled on animals detecting medical conditions. "Her left lung does show more opacity on the x-rays," he acknowledged. "We've attributed it to the pneumonia, but she's not responding to treatment as expected." Rex has never behaved this way with any other patient. He's breaking years of training to alert to something near her left lung. Dr. Levine's pager beeped. That's Emily's room. We need to go. Now. They rushed to find Emily in the midst of a severe coughing fit, each hack seemingly more painful than the last. Flecks of blood specked the tissue Sarah held to her daughter's mouth. Oxygen saturation dropping to 87%, called the responding nurse, already adjusting flow rates. Dr. Levine moved with practice urgency, calling for additional medication and a stat-portable chest x-ray. In the controlled chaos, Rex's behavior transformed completely. Gone was the calm therapy dog, replaced by an animal in obvious distress. His whines grew urgent, his body trembling with tension as he strained toward Emily's bed. Get that dog out of here immediately, Dr. Pembroke ordered as he arrived. This is exactly what I warned about. Animal dander triggering a severe response. Rex hasn't been near her today, Candace protested. We just arrived when she began coughing. As a security officer appeared to escort them away, Rex did something he had never done in his therapy career. He barked sharply, the sound slicing through the medical instructions and beeping monitors. Then a second bark, and a third, each one directed specifically toward Emily's left side. The dog is out of control, Dr. Pembroke snapped, preparing to intubate Emily, whose breathing was becoming dangerously labored. A memory hit Candace with jarring clarity. Her previous therapy dog barking just like this at her neighbor's house years ago. 2 days later, that neighbor had suffered a massive heart attack in exactly the spot the dog had focused on. She had promised herself never to ignore such signs again. Dr. Levine, Candace called forcefully. Rex is alerting to something specific in Emily's left lung. This isn't random behavior. Something is seriously wrong beyond standard pneumonia. This isn't the time. It's exactly the time, Candace insisted. He's detecting something you haven't found yet. Please, just consider additional testing focused on the left lung specifically. Dr. Pembroke approached Candace directly, his voice lowered to an intense whisper. Your dog is interfering with emergency medical care. Either remove him voluntarily or security will do it for you. With respect, doctor, I believe you're missing a critical diagnosis. Rex has been alerting specifically to her left lung for over a week. This isn't pneumonia, or not just pneumonia. Based on a dog's behavior, this isn't a television drama where animals magically diagnose rare conditions. Based on documented cases of canine medical detection, Candace corrected firmly, dogs have identified cancers, infections, and metabolic disorders before medical tests caught them. Emily's monitoring equipment suddenly emitted a shrill alarm. Blood pressure dropping. O2 sat at 82%. She's decompensating, Dr. Levine announced. Prepare for emergency intubation. Dr. Levine, Candace called as she was being pulled from the room. Please check for fungal infections. Left lung, upper quadrant. That's where Rex has been focusing. In the lobby, Candace pulled out her phone and called Dr. Henrietta Simmons, chief of medicine, who had initially approved the therapy dog program. Dr. Simmons, this is Candace Wheeler. I need to speak with you urgently about a patient named Emily Winters. I believe she's in life-threatening danger from a missed diagnosis. 40 minutes later, Candace sat across from Dr. Simmons in her office, Rex lying tensely at her feet. Let me be clear, Dr. Simmons said, after reviewing Candace's documentation. You believe your therapy dog has been detecting a fungal infection in Emily's lung, something the medical team has missed. I believe Rex is alerting to something specific in her left lung that isn't being addressed by current treatment, Candace replied carefully. His behavior is identical to documented cases of medical alert dogs identifying health threats. Dr. Simmons frowned. While I respect the therapy program, making medical recommendations based on animal behavior is well outside protocol. I understand that. But Emily has been hospitalized for nearly 2 weeks with worsening symptoms despite appropriate antibiotic therapy. Something is being missed. The administrator checked her computer. Emily's case has been escalated. They're preparing her for transfer to University Medical Center. That transfer will take hours to arrange, Candace pressed. Rex has been alerting to something urgent. Please, just consider requesting specific testing for fungal infections in her left lung. Dr. Simmons studied Candace for a long moment, then Rex, who maintained eye contact with an almost human intensity. "Wait here," she said finally, rising from her desk. 20 minutes later, Dr. Simmons returned with Dr. Levine. "Ms. Wheeler," he began, "I've ordered a specialized bronchial wash and fungal panel for Emily, along with high-resolution CT imaging focused on the left upper lobe." Relief weakened Candace's knees. "Thank you for considering it." "Don't thank me yet," he cautioned. "This is highly irregular." Dr. Pembroke strongly objected to changing protocol based on non-medical indicators. "What changed your mind?" Candace asked. "Emily coughed up sputum with unusual characteristics right after you left. The pattern, it wasn't consistent with bacterial pneumonia, and frankly, nothing else in our treatment plan is working." 4 hours later, Candace's phone rang. "Ms. Wheeler, this is Dr. Levine. You were right." The CT scan and bronchial wash had revealed what multiple X-rays and standard protocols had missed: a small cavitary lesion in Emily's left upper lobe, harboring a significant Aspergillus infection. The fungal growth had been hidden behind denser pneumonia infiltrates, invisible on standard imaging, but gradually expanding until it reached a critical mass. Aspergilloma can mimic bacterial pneumonia symptoms while not responding to antibiotic therapy, Dr. Levine explained. It's rare in children without underlying conditions, which is why it wasn't on our initial differential diagnosis. Emily likely inhaled the spores during renovation work at her school. The fungal ball had created a cavity, approximately 2 centimeters in diameter, he continued, his voice taking on the measured tone of a physician carefully translating complex medical information. The growth was positioned in such a way that it was obscured on standard X-rays by the surrounding pneumonia infiltrate. Even our routine CT scan didn't provide the resolution needed to distinguish it from consolidated lung tissue. The specialized bronchial wash revealed Aspergillus fumigatus, an invasive fungal species that can be particularly aggressive when the host immune system is already compromised by another infection. He paused, seemingly choosing his words with care. Without detection, these fungal masses can erode into pulmonary blood vessels. When that happens, his voice trailed off, but the implication was clear. The fact that your dog consistently alerted to the exact anatomical location is medically significant. Emergency bronchoscopy removed much of the fungal mass, and Emily began intensive antifungal therapy. Without prompt intervention, the infection would have continued expanding, potentially causing catastrophic lung bleeding or spreading to other organs. "How did your dog know?" Dr. Levine asked. "We needed specialized imaging and laboratory work to identify it. Research suggests dogs can detect volatile organic compounds released by certain fungi and bacteria," Candace replied. "Their olfactory capabilities are thousands of times more sensitive than ours." When Candace arrived at the hospital the next morning, she found not just the medical team, but also Dr. Simmons and the hospital's research director waiting in the conference room. Most surprising was Dr. Pembroke's demeanor, his hostility replaced by scientific curiosity. "Ms. Wheeler," he began, "I've spent much of the night reviewing literature on canine scent detection in medical contexts. The capabilities are more extensively documented than I previously understood." The medical team proposed a preliminary study to evaluate therapy dogs' potential for early detection of complications. Dr. Pembroke, while still expressing concerns about infection control, could not dispute the outcome in Emily's case. "Without your dog's persistence, we would have missed a life-threatening condition until it was potentially too late." The hospital corridor outside Emily's room gradually transformed over the following weeks. Get well cards multiplied daily. Colorful drawings from her classmates depicted a smiling blonde girl beside a golden retriever wearing a cape. Nurses had started referring to room 612 as the miracle room. Emily's recovery progressed steadily after the correct diagnosis. The targeted antifungal therapy worked effectively against the Aspergillus infection, while continuing antibiotics addressed the remaining pneumonia. 3 times weekly, Rex made official visits, his therapy vest now accompanied by a special tag reading, Honorary Diagnostic Assistant, a small joke from the pediatric residents that carried more truth than initially intended. Dr. Levine often coincidentally checked on Emily during these visits, his questions about Rex's training becoming increasingly specific. More surprising was Dr. Pembroke's gradual evolution. While he still maintained strict protocols about when and where Rex could visit, he had begun quietly observing the therapy sessions, clipboard in hand. The literature is limited but intriguing, he acknowledged during one such observation. Canines appear to detect certain volatile organic compounds at concentrations of parts per trillion, potentially useful for early detection modalities. 2 weeks after the diagnosis, Emily sat cross-legged on her bed, an achievement that would have been impossible before, watching as Rex demonstrated a new trick. "I'm going home tomorrow," she announced, her voice clear of the rasping quality that had characterized her long illness. "Mom says you and Rex can visit me there too." "Absolutely," Candace confirmed. "Rex does home visits for children transitioning from hospital care." From the doorway came an unexpected voice. "Assuming proper protocols are followed, of course." Dr. Pembroke entered carrying Emily's chart, maintaining a measured distance from Rex, but no longer acting as though the dog might contaminate the entire ward. "Your latest cultures show no remaining fungal elements," he informed Emily. "The CT scan shows significant clearing of both the fungal cavity and bacterial infiltrates." "Thanks to Rex," Emily added with the absolute certainty of childhood. Dr. Pembroke's pause was nearly imperceptible. The medical intervention was necessary, but yes, the early detection was significantly facilitated by the animal's behavior. Later that afternoon, Candace was summoned to Dr. Simmons' office to find not only the chief of medicine, but also Dr. Levine and Dr. Pembroke waiting for her. "We've been discussing the implications of Emily's case," Dr. Simmons began, "and reevaluating our approach to the therapy dog program." Dr. Levine slid a proposal across the desk, outlining a formal protocol for tracking unusual alerting behaviors in therapy animals and establishing guidelines for when such observations warranted additional medical investigation. "This isn't about dogs replacing diagnostic equipment," Dr. Pembroke clarified. "It's about recognizing that in certain limited circumstances, animals may detect physiological changes before they become clinically obvious through standard assessment." "We're calling it the Integrated Animal Response Protocol," Dr. Simmons added. "Emily's case will be submitted to the Journal of Pediatric Medicine as the initial case study." The protocol itself was remarkably comprehensive for something developed so quickly. The 20-page document outlined specific procedures for when therapy animals displayed unusual alerting behaviors, complete with observation checklists, communication pathways between handlers and medical staff, and criteria for when to escalate concerns to attending physicians. Most groundbreaking was the section on multimodal diagnostic approach that positioned animal behavior as a legitimate observational tool alongside traditional vital signs monitoring. "We're not suggesting that dogs replace laboratory tests or imaging," Dr. Pembroke had insisted during the drafting process, his clinical precision evident in every carefully worded paragraph. "Rather, we're acknowledging that animal alerting patterns may provide early indicators that warrant further investigation through conventional medical means." The real breakthrough had been his reluctant inclusion of a sentence that would have been unimaginable weeks earlier. "In cases where standard diagnostic protocols have failed to identify causative factors for persistent symptoms, documented animal alerting behavior may be considered as supportive evidence for pursuing specialized testing." 2 months later, a small ceremony was held in the hospital's atrium. Emily, now fully recovered and back in school, stood proudly beside her parents as Rex received a custom-designed honorary hospital badge. Local media covered the event, broadcasting the story of the therapy dog who detected a hidden fungal infection when medical tests missed it. Most surprising was Dr. Pembroke's brief statement to the press. "While maintaining appropriate infection control remains essential, we must also recognize that our patients benefit from an integrated approach to care The canine olfactory system can detect certain compounds at concentrations far below our technological capabilities. It would be scientifically irresponsible to ignore such a potentially valuable diagnostic indicator. As cameras captured Rex sitting perfectly beside Emily, Candace noticed Dr. Pembroke watching with what almost resembled satisfaction. Your dog has certainly complicated my professional perspective, he commented quietly. In a good way, I hope, Candace replied. Science advances through challenged assumptions, Ms. Wheeler. Even when the challenge comes from unexpected sources. He glanced toward Rex. The IARP guidelines will be presented at the National Infectious Disease Conference next month. Your assistance with the presentation would be valuable. It wasn't friendship exactly, but it was respect, hard-won and genuine. After the ceremony, Emily knelt to hug Rex tightly. You knew I was really sick when nobody else did, she whispered into his golden fur. How did you know? Rex, of course, couldn't answer, but his gentle nuzzle against her now healthy chest seemed to say everything that mattered. If this incredible story of Rex's life-saving intuition touched your heart, make sure to hit that subscribe button and turn on notifications by clicking the bell icon. Your support helps us continue bringing these remarkable stories about the extraordinary bond between humans and animals to light. We'd love to hear your thoughts in the comments below. Have you ever witnessed an animal sensing something that humans missed completely? Do you believe that medical science should incorporate animal intuition more formally into diagnostic protocols? Check out our previous videos appearing on your screen right now, and we'll see you again tomorrow at same time with a brand new story.